Hey everyone, my name's Wade Sutton and I'm a principal career coach with Breaking Into Device. Today is our first episode of the Breaking Into Device series. We're going to be learning a little bit more about myself and discussing some questions that some of our users had posed for me. So let's go ahead and get started. Let's jump into the first question I always get from my mentees in my one-on-one coaching sessions within Breaking Into Device. What's your story, Wade, and why did you get into medical device sales? So a little bit about myself. I'm from Toledo, Ohio. I started school at The Ohio State University studying marketing in August of 2014. And I knew I wanted to go into sales. It kind of runs in my blood a little bit. My dad was in sales. I did some sales competitions in high school. I really enjoyed connecting with customers and persuasively conveying value to them. But in terms of industry, I was a little bit lost. Especially when I was at Ohio State in my first 2 years. I picked up a computer science minor because I thought I wanted to go into technology sales, but I ended up in Charlotte, North Carolina between my sophomore and junior year at a healthcare purchasing conglomerate called Premier. Premier basically represents a group of hospitals nationwide and negotiates better pricing with manufacturers. And I was in operations, so not exactly sales, but I felt this deep meaning from my work. I felt that what I did mattered. I could go home with a sense of pride because I knew I was helping patients achieve better outcomes in hospitals, surgery centers, etc. So after that summer, I wanted to get a little bit closer to the customer. I was fortunate enough to end up at Cardinal Health, which is a large medical device and pharmaceutical distributor, specifically medical consumables. And I was working as a marketing intern that summer. I was working with skin and wound, and I got a lot of great exposure to the corporate side of the business, and I got a lot closer to the customer, but it still wasn't selling. So I took the next step upon graduation in May of 2018 at Ohio State. I was once again fortunate enough to accept a position at Cardinal Health within their sales development program out of Chicago, Illinois. And this was a four business unit rotational program where I trained on the corporate side of Cardinal Health, the sales side of Cardinal Health. And after those 12 months, I was once again fortunate enough to land a position back in Charlotte, North Carolina as a sales consultant selling to ambulatory surgery centers. And I did that for about 11 months. It was great exposure. I learned how to prospect. I learned how to create deals. But I was primarily selling gloves, drapes, and other OR consumables. And I wasn't necessarily developing the relationships that I wanted to clinically with those surgeons and physicians. And that's what most people think of when they hear medical sales. They think of selling to surgeons and physicians, which oftentimes it is. We'll get into that in another question, really. What is medical sales? So I decided to pivot in my career, and I moved back to Chicago where I had started training and started a position with Johnson & Johnson within their subsidiary DePuy Synthes, specifically in the Synthes arm of the business, servicing surgeons on orthopedic trauma. So I gained a ton of knowledge clinically from that. I went from selling gloves, gowns, drapes, and packs and dealing mostly with supply chain administration and purchasing to being in front of surgeons in the operating room, advising those surgeons and nurses and techs on the best way to use our products. When you hear trauma, it's a little bit different than you might imagine, especially in the world of orthopedics. So this is not someone coming fresh out of a car accident and us putting them back together. It's usually once they're stabilized, if they have any fractures, malunions, or non-unions in any of their long bones, pretty much anywhere besides the skull, spine, and ribs. If those bones broke, we were putting them back together. So I was in that position for 12 months as a junior sales consultant, and just recently I took a huge step in my career journey. I'm actually going to be an entrepreneur here, starting my own distributorship. And a distributorship is basically an entity that serves as a selling organization between medical device manufacturers that don't hire their own sales reps and those providers that use that product. So I'll be focusing on foot and ankle orthopedics in the coming year, selling to surgeons with some really exciting lines. But kind of looking back, it started in college with an interest in medical sales. And for a lot of folks, it's a dream that seems a bit unattainable. But I'm hoping through this series and through the Breaking Into Device website, I can make that path a little bit clearer for folks that are trying to break into the industry. It's not impossible. You just have to be disciplined and have a plan. All right, so the next question I usually get from my mentees during our coaching sessions is, what did your day-to-day look like? Now, orthopedics is a beast. It's very different than other types of medical device sales, just because there's so much of a service aspect to what we do. So when I refer to orthopedics, I'm primarily referring to orthopedic trauma and extremities, sports medicine, spine, craniomaxillofacial, and joint reconstruction. So there are three main activities that consisted of my day-to-day work. The first was case coverage. So in the world of orthopedics, specifically in the world of implants, this is throughout all medical device sales, when you are selling an implant or a system that has implants, it's very important that you service the surgeons and the staff during the procedure. That means physically being in the operating room, in scrubs, in a hat and a mask, about 5 to 10 feet away from the sterile field, just advising everyone on how to use your products. Some surgeons know exactly how to use your products. Others might be a bit newer, a little bit fresher, and you have to advise them on how to use your systems. But one of the biggest components when you're actually servicing cases is advising the scrub techs and the nurses on how to be best prepared to keep in step with the surgery. So for example, we had at least 50 different systems. Like I said before, we were covering fractures from the fingertip all the way down to your toes, everything in between. So it's a lot for that staff to know with 50 different systems. And in orthopedic trauma, we were primarily selling 4 things physically, 4 implants: plates, screws, nails, which are also known as rods, and wires that would wrap around bones in different constructs. So you have to be in the operating room to service them during usual business hours. Cases would usually start around 7:30 in the morning. Unfortunately, with trauma, there's a lot of add-ons. So these surgeries are not scheduled very far in advance. If you talk to a joint reconstruction rep at a different company or at Synthes, you'll hear, oh, we have a case scheduled next week. Very rarely did we get a week's notice for some of these cases. Sometimes we only had a couple hours. So usually start around 7:30 in the morning, cover cases all day, sometimes very late, oftentimes on the weekend. As a junior, I worked every other weekend, so I was working 6 days a week, and I was helping these surgeons and staff through the surgeries. The next big part of my day-to-day work was inventory management. So this was not something that came naturally to me or that I really knew about going into this, because I was a salesperson. I didn't understand the amount of detail orientation that you had to have for this career and how focused you had to be in terms of actual physically putting things together. So oftentimes we would have something called a tray that we would open up in surgery. It's basically a big box with holes in it that would allow the steam to come in and sterilize the components, the instruments, the implants, and be wrapped in a fancy blue wrap. And when we were done with the case, your work's not done. You've got to go down to the sterile processing department, usually in the basement, and pretty much reassemble these trays, make sure they're restocked, because in trauma, you never know when the next surgery is going to be. So, servicing those surgeons in the operating room, inventory management, making sure those things called trays are restocked. It's huge in orthopedics. And then logistics. Unfortunately, in the world of healthcare, money can be a bit tight. So not every hospital has all of those instruments, implants, and trays that they need for every surgery, especially in the world of trauma. There's so many different systems. Hospitals can't exactly afford to have every single tray for every single procedure. So after you were done servicing the surgeons, restocking the trays, you get notification of another case in another hospital and say, How are we going to get those instruments, implants, and disposables in that tray to another hospital or another surgery for another case? So there's quite a bit of logistics as a trauma rep as well. The most fulfilling part for me, and the part that I felt like I was the best at, being more of like a natural salesperson, was being in the operating room, communicating with surgeons, and guiding them through the procedures. Of course, that took some time. Selling gloves, drapes, gowns, disposables, and consumables at Cardinal Health, I didn't have that OR experience. So I had to come in as a junior. I had to start out as a junior rep, even though I was a sales rep at Cardinal Health. Where do you start? Oftentimes, it is going to be as a junior sales consultant or an associate sales consultant, just because you don't have that clinical knowledge base to be able to start selling immediately. So, moving on to the next question I often get. What advice do you have for me strategically to try and break into medical device sales if you don't have much experience? Now, there's a couple of different avenues loaded into this question, a couple of different scenarios. So first, you might be a student. Second, you might be graduated from college and have some general experience, maybe related to sales, maybe not. And third, you're a sales professional that has sales experience in likely business-to-business sales, but it's not in healthcare. Let's start with the first avenue. So you're a student that wants to get into medical device sales. I think the biggest misconception people have is that your major is extremely important in terms of landing in the industry. Of course, it helps to have a background in business, a background in science, or a background in healthcare, some type of major that aligns with those. It's not completely necessary. What's important is to show interest while you're in school, that you can gain transferable skills that would make you a good rep in medical device. So that means trying to get as many healthcare or medical device related internships as you possibly can, or also possibly doing on the side, it could even be business to consumer, some sort of sales experience. Now, not every person that's a student is in the right time frame to do those things. So for example, if you're interested in medical device sales and it's your freshman year, you've got plenty of time to adjust your major, to look at internships at medical device companies or healthcare companies, and to get some sort of sales experience. But let's just say it's your senior year and you're graduating and you haven't done those things. Don't worry about it. All is not lost. It's important for you to target specific types of medical device firms. So if you don't have sales experience or any healthcare internships and you're interested in medical device, your best bet is likely going to be looking at a smaller distributorship, which I discussed in one of my questions earlier, something that I'm actually starting on my own. It's going to be very difficult for students to come right out of school and land at some of the larger, more well-known firms if you don't have a little bit of work experience first. For example, like I discussed, I had to work at a healthcare consumables organization, Cardinal Health, before I actually got into true medical device. So I kind of earned my stripes that way. I had a couple of internships that helped me get to Cardinal Health, but I still had to have that business-to-business sales experience before I could get more clinical. But with distributorships, they're often smaller, geographic, and they're looking for younger talent coming right out of school to jump into their organization. They're a little bit harder to find than just maybe Googling Johnson & Johnson Associate Sales Consultant on Google or LinkedIn or looking at job boards. Our best practice is actually typing in medical device distributorship into Google and then also typing in your target area or the city that you're looking to live in. It could be the city that you're living in now, it could be a place that you'd like to move to. And that's generally the best way to find these distributorships. So the next two scenarios we're going to look at are experienced hires. I kind of broke it into three avenues. We're going to combine the last two. You graduated from school. Let's say you're out of school for a year. You could be out of school for 3 years. You could be out of school for 10 years. You could be out of school for more. There's no wrong time to try to get into medical device sales. Really, there's not. So it's not necessarily pertinent that you have business-to-business sales experience. It really helps in some scenarios, and oftentimes you can actually jump the associate stage if you have 5 to 10 years of business-to-business sales experience with a great track record at a well-known company. You might actually be able to skip the associate or junior stage that many folks are kind of forced into, like I was, before you become a full-on sales representative. But what's important at this stage is that you demonstrate a strong desire for the right reasons to be in medical device sales. A big thing that draws folks in is compensation. It's important that you let prospective employers know that you're motivated by compensation. That's important in any sales job, because the more you're motivated by that, the harder you're going to work for the organization. But it's also important that you communicate you want to get into medical device sales to ultimately help the patient. That is what these organizations are founded on. It's their mission. And you need to align your personal mission with that of the organization that you're applying for. What's one piece of advice I have for people from all different avenues trying to break into medical device? You need to network very aggressively and very strategically too. It can feel a little bit uncomfortable, but you need to be assertive. You need to have a high quantity of touches, and you need to get in contact with people. One of my least favorite phrases is, to get into medical device sales, you have to know someone. I'm not a huge fan of that because I didn't know anyone in medical device sales. What I did, though, was get to know people in medical device sales. There's this misconception that your brother or your uncle or your dad or your best friend, someone has to be a hiring manager at a medical device sales company, and that's how you kind of sneak in. I would say about 90% of people, maybe 95% of people getting into medical device sales without experience in medical device sales do it by being fanatical networkers. This starts on LinkedIn. It also, unfortunately, starts with a bit of a commitment on LinkedIn. I strongly encourage folks to get LinkedIn Premium to be able to target as many people as possible. I understand that this isn't within everyone's budget, but if you look at the $30 a month you spend on LinkedIn Premium, it pays off dividends when you're making 6 figures down the line in a successful medical device sales career. So fanatical networking is the way to land a position in medical device sales. Be concise, be yourself, and have a high quantity of touches with people in the industry. And eventually, this is one of my favorite pieces of knowledge, you only need to really get lucky once. It's going to seem like a lot of people are ignoring you, a lot of people don't want to talk, you're just another person trying to get into the industry any way they can, but someone will connect with you. And you'll develop a deeper connection with this person through talking on the phone, meeting in person, and they'll kind of serve as your coach or your champion. And you don't necessarily need to be reaching out to the hiring manager every time. That's helpful. It shows initiative. But also reaching out to people in your target companies that might be in different roles, people on the team that you might be working on, or people that have had experience in the past at the company. It's a very small industry. And the more aggressive you can be in reaching out to folks, primarily on LinkedIn, the more successful you'll be in breaking into the industry. Thank you everyone so much for tuning in to episode 1 of the Breaking Into Device series. Really excited. Next week, we're going to have someone from a different part of the industry that's currently a sales representative come onto the show to talk. More to come. Tune in. Thank you for letting me explain my story, explain some nuggets and advice I had for breaking into the industry. And if you ever want to get in touch with me, just reach out to me on the website. I'd be happy to talk, and we can explore your situation personally in a little bit more detail. So thanks again, and tune in next week.